Okay, let's talk about something that's incredibly important for our health awareness, the early signs of breast cancer. Knowing what to look for can honestly make all the difference, so we're gonna dive right in.
So why does this matter so much? Well, check out this number. According to the National Cancer Institute, about 1 in 8 women in the US will be diagnosed with breast cancer at some point. That's almost 13%. And look, that's not just some abstract statistic. It's a powerful reason why being informed is so critical for every single one of us. But here's the thing, and it's really the whole point of this explainer today. While we can't always prevent breast cancer, we can absolutely fight it way more effectively when it's caught early. And that all starts with knowing what you're looking for.
All right, so let's start with the sign most of us have probably heard about, a breast lump. But as you're about to see, it's not always as simple as it sounds.
So what exactly is a breast lump? Well, it's any new mass that you can feel in your breast tissue. It is by far the most common first sign, and you might be surprised to learn it can be as tiny as a pea.
But here's where it gets a little tricky. Not all lumps are created equal. A cancerous lump is often painless and has these irregular, kind of jagged edges, almost like it's growing into the healthy tissue around it. On the other hand, a lot of non-cancerous lumps, like a fluid-filled cyst or just fibrocystic tissue, which is really just a fancy way of saying lumpy breast tissue, tend to be smoother. Here's the most important part though. You can't tell for sure on your own. Any new lump, period, needs to be checked by a doctor.
And just to make things more interesting, cancerous lumps don't always play by the rules. Sometimes they can be soft, round, or even painful. It's also super important to remember to check your armpit area for lumps too. But let me leave you with this really comforting fact. The vast majority of breast lumps are not cancer. So the message here is simple. Don't panic, but do get it checked out.
Okay, so that's what you might feel. But what about what you can see? There are actually some really important visual signs to be aware of, both on the breast itself and on the nipple.
So when you're looking, what kind of visual changes are we talking about here? Let's break down the key things you might notice.
First, pay attention to any swelling, even if you can't feel a definite lump. Another very specific thing to look for is skin dimpling, where the skin texture kind of resembles an orange peel. You also want to keep an eye out for any weird skin changes like flaking or thickening, or maybe an indentation that just stays there. Honestly, any sudden change in size, shape, or color that's not normal for you is worth paying attention to.
The nipple itself can also give you some major clues. You're looking for things like a nipple that suddenly starts to turn inward. That's called inversion. Or maybe you notice some new redness, crusting, or any kind of discharge that isn't breast milk, especially if it's bloody. And of course, any new or lasting pain is something you should take seriously.
Okay, now before you start to worry, and this is super important, many of these visual changes are not cancer. They can be totally normal things caused by aging, your monthly cycle, or even some medications. The point here isn't to create alarm. It's just to build awareness so you get to know what's normal for your body and you can spot what isn't. All right, we've covered what to look for. Now let's talk about a couple of other things you might feel that go beyond a distinct lump.
You know, sometimes the change isn't a clear, pea-sized lump. It might just be an area of tissue that feels thicker or denser than everything around it. It can be a really subtle firmness that just wasn't there before. It's a less obvious sign for sure, but it's just as important. And what about pain? It's a really common worry, but here's the good news. Most breast pain is not caused by cancer. It's usually tied to hormonal shifts or other harmless conditions. Still, if you have a new pain that just won't go away and it's in one specific spot, it's always best to get it checked out.
So the bottom line is, things like fibrosis, which is just dense, fibrous tissue, or even certain medications can cause that feeling of thickening or pain. But, and I can't say this enough, you can't diagnose yourself. The only way to know for sure what's going on is to talk to a healthcare provider.
Okay, we've talked about the signs. Now for maybe the most important part of this whole conversation. What do we do with this information? This is all about shifting from just being aware to taking action. And that starts with screening.
This is the question everyone asks, right? When do I actually need to start getting screened? Let's take a look at what the official guidelines say for people who have an average risk.
So there are a couple of major guidelines out there, and you'll notice they're a little different. The U.S. Preventive Services Task Force, that's the USPSTF, now recommends getting a mammogram every 2 years starting at age 40. The American Cancer Society, or ACS, suggests starting regular screening sometime between 45 and 54. Since the advice varies, the absolute best thing you can do is have a conversation with your doctor about what makes the most sense for you.
Now that whole timeline we just talked about, it changes completely if you're considered high risk. If you've got a strong family history of breast cancer, or you know you have a genetic mutation like BRCA, or you've had radiation to your chest in the past, your doctor is probably going to recommend starting screenings much earlier, often around age 30.
You know, after all the science and all the guidelines, it really comes down to this one simple, powerful idea. Trust your gut. You know your body better than anyone else. If something feels off, just don't hesitate. Talk to a healthcare provider.
And that really brings us to our final thought here. This isn't about being worried all the time, it's about being aware. So, what's one thing you can do this week, just one, to get to know your body a little better? Whether it's setting a reminder to do a self-check or finally scheduling that doctor's appointment, that self-awareness is your most powerful first step. Thanks for listening.